Imagine finding out you're enrolled in end-of-life hospice care, not from a doctor, but because your pickleball injury was just denied by Medicare.
Yeah, I mean, it sounds like a bad joke, right? But for an alarming number of people right now, that is a terrifying reality.
And, well, it's actually the spark behind a massive crisis that is currently freezing the United States government. Right
Right.
now, lawmakers are just entirely deadlocked. The
Yeah.
federal government is in a partial shutdown over homeland security, border policies, and these expiring healthcare subsidies.
Right. And meanwhile, average families are getting hit with just skyrocketing health insurance premiums. I mean, we're seeing rates jump like 24% in Maine.
Yeah, and in Georgia, Obamacare premiums could actually quadruple next year. Behind this whole pricing crisis is a massive financial drain that honestly most people know absolutely nothing about.
Hmm.
A staggering $50 billion is stolen from Medicare every single year.
$60 billion. That is money meant for patient care just vanishing from the system annually. It's wild.
So today, we are doing a deep dive into how a seemingly invisible crime happening in empty office parks in California is the exact reason your health insurance bill might double next year, and why it's currently holding the entire federal government hostage.
Yeah, we really need to follow the money here. From stolen identities to the cutting-edge AI the government is using to fight back, all the way to the 2026 Senate battlegrounds.
Right. So to understand why the healthcare system is buckling under this financial pressure, we first have to look at exactly how and where the money is bleeding out.
Exactly. And the best place to start is with the human cost, like that pickleball incident you just mentioned.
Yeah, so this comes from the congressional testimony of Dr. Lignani. Someone, somehow, got hold of her Medicare number. And instead of maxing out a credit card, these scammers used her identity to enroll her in a fake hospice program.
Which is, I mean, it's incredibly strategic on the scammer's part, because hospice care is designed for people at the very end of their lives, right? Providing comfort rather than a cure.
And it's expensive.
Very expensive. Medicare pays out thousands of dollars a month for these services, so the fraudsters just sit back and collect those monthly checks for patients who are not actually dying, or in some cases, patients who don't even exist.
But Dr. Riani was perfectly fine. She was out playing a very active game of pickleball, hurt her knee, and went to get treatment.
Right, and that is when she hit a brick wall. When her actual doctors tried to bill Medicare for her knee injury, the Medicare computer system automatically rejected the claim.
Because according to the computer, she's dying.
Exactly. The system's logic is brutal but simple. If a patient is receiving end-of-life hospice care, well, they don't need knee surgery, they don't need preventative care. So the system just blocks legitimate, necessary medical treatments.
And untangling that mess isn't just a quick phone call, is it?
Oh, not at all. Victims spend hours, sometimes weeks or months, trapped in this bureaucratic nightmare trying to prove they aren't dying, just so they can get a legitimate surgery or, like, basic medication.
Wow. And the scale of this deception is just massive. When you look at the $60 billion lost annually across federal health programs, that breaks down to roughly $858 stolen per legitimate Medicare beneficiary every single year.
Yeah, it's a massive hidden tax on the entire system.
Okay, let's unpack this a bit because
Oh.
$60 billion, just to put that in perspective, that is more than the entire gross domestic product of some actual countries, just disappearing into thin air. How is that even possible?
Well, a lot of it traces back to highly organized, concentrated fraud rings. California recently became ground zero for this hospice fraud epidemic. Citizen journalists and patient advocates actually started looking up the physical addresses of these newly registered hospice companies.
And what did they find?
They drove out to the locations and found completely empty office spaces.
So no nurses, no beds, no medical equipment.
Nothing. Just locked doors with mail spilling out of the slots. The operators running these paper companies drive luxury vehicles and totally refuse to answer questions. It became such an undeniable problem that the federal government actually had to step in and shut down 450 of these fake hospices in California.
And the detail that really highlights the audacity of this crime, right?
Yeah.
Out of those 450 companies that had their payments frozen, not a single one called the government to ask where their money went.
Because they knew the gig was up. I mean, they took the cash they'd already stolen and simply disappeared. In Los Angeles County alone, investigators flagged over 700 of the roughly 1,800 registered hospitals for multiple signs of fraud.
Wait, 700?
Yeah, That means nearly 40% of the county's end-of-life care providers were operating highly suspicious businesses.
It sounds like a cartoon bank robbery where the thieves don't even bother wearing masks.
It really does. One investigation found a single physical building that served as the registered address for 89 different hospice companies.
That is insane.
Right, and they're generating paperwork for ghost patients out of thin air. In one specific case, a fraudster posing as a medical social worker wrote out highly detailed, deeply emotional notes about a family grieving at a patient's bedside. But when investigators dug into the files, they realized the patient never actually existed.
But we also see the system being exploited by actual licensed professionals.
Yeah.
Like the case of Dr. Rajiv Buva.
Yes, exactly. Investigators found his name listed as the certifying physician on Medicare claims for nearly 2,800 different patients.
Which is physically impossible.
Right. If you actually calculate the hours required to evaluate and treat 2,800 dying patients spread across 126 different California hospices in a single year, the math just doesn't work. He lost his billing privileges, obviously, but the sheer volume of claims processed under one doctor's name reveals a massive vulnerability.
And this is the part that I struggle to understand. How does one doctor get tied to 126 hospices without a government computer system instantly freezing the payments? Like, if a credit card company sees me buy coffee in New York and a television in Paris 5 minutes later, my card is shut off immediately.
Yeah, it's instant.
So why doesn't Medicare work that way?
Well, it's because the healthcare system relies on a concept called the pay and chase model. Medicare processes millions upon millions of legitimate claims every single day. And the absolute highest priority for the government is to pay doctors and hospitals quickly.
Okay, so they prioritize speed over security.
Exactly. If they freeze the system to thoroughly investigate every single claim, legitimate hospitals can't make payroll. Rural clinics would literally go bankrupt waiting for their funds to clear.
So it's like an open bar at a massive wedding. You just walk up, give a name, and the bartender hands you a drink because they just want to keep the line moving. They assume you belong there.
That is a perfect analogy.
Right, and they don't stop to check your ID until the wedding is over. And by then, the wedding crashers are long gone with all the expensive champagne.
They're totally gone. The fraudsters know the system is optimized for speed. They exploit that. The government pays the bill first and then tries to chase down the criminals later. But, once that taxpayer money hits a shell company's bank account, it's immediately transferred offshore or laundered.
Making it nearly impossible to recover.
Exactly.
So if you can't slow down the money without collapsing real hospitals, how do you catch the fakes?
That is the multi-billion-dollar question, and it's driving the government's shift toward artificial intelligence and advanced data analytics. They desperately need better tools because a recent Government Accountability Office report, the GAO, found that $121 billion in improper payments went out across just 5 government programs in 2024.
Wow. Just to clarify, though, improper payments encompass flat-out criminal fraud, but also administrative errors, right? Like paying the wrong amount or sending a check to the wrong clinic.
Correct. But regardless of intent, it is still billions of dollars lost. So to stop this, investigators are using machine learning models trained to hunt for 3 specific patterns: scale, connections, and outliers.
Let's look at how those mechanisms actually work in the real world, starting with scale.
Right. So scale is about volume and timing. A human auditor might not notice if, say, 3 suspicious claims come from Los Angeles, 2 from San Diego, and 4 from Sacramento over a weekend. But an AI instantly flags when 5,000 identical claims hit the server at 3 a.m. on a Sunday. It sees the massive surge.
Got it. And connections is about finding the invisible threads tying these shell companies together.
Precisely. Because scammers are sloppy. An algorithm can instantly cross-reference databases and realize that 50 completely different patients enrolled in 5 different hospices all list the exact same burner phone number.
Oh, wow.
Or it notices that Medicare payments for a dozen different clinics are all routing into the same offshore bank account.
Which leaves outliers. And this goes back to the doctor billing for 2,800 patients, right?
Exactly. AI calculates the physical limitations of time and space. If a doctor bills for 30 hours of continuous treatment in a single 24-hour day, or bills for travel times that would require a supersonic jet, the algorithm catches it instantly.
Makes sense.
And even basic data matching, which is older technology but incredibly effective, is saving a fortune. The government finally started cross-referencing Social Security death records directly with Medicare claims.
Wait, they weren't doing that before?
Not efficiently.
Yeah.
Just by making the computer verify that a patient was actually alive before sending out a medical payment, they saved $109 million in a single year. And in another tax program, simple data matching caught 58,000 dead people receiving tax credits.
Okay, but hold on. I have to play devil's advocate here for a second. AI hallucinates all the time. I wouldn't trust a generative AI chatbot to do my taxes or fix my plumbing. So how can we possibly trust an algorithm to decide who gets federal Medicare funding?
You're hitting on the exact danger that keeps data scientists awake at night. In the tech world, there is a golden rule: garbage in, garbage out. AI models are entirely dependent on the historical data used to train them.
So if the data is bad, the AI is bad.
Right. If the government's training data is incomplete, outdated, or biased, the AI will make terrible decisions.
And I'm guessing criminals know this.
Oh, they absolutely do. Hackers use a tactic called data poisoning. They don't just try to shut the system down, they subtly inject fake data into the baseline training models.
Oh, so they teach the AI bad habits.
Exactly. It's like training a guard dog from birth that burglars wearing ski masks are actually just members of the family. The AI learns that fraudulent behavior is the baseline normal, so the actual fraud slips right through undetected.
Plus, if an algorithm makes a mistake, the stakes in healthcare are literally life and death. If a self-driving car makes a slight error, it recalculates. But if a fraud detection AI makes a mistake, what they call a false positive, it automatically denies a payment.
And that is why government reports continually insist on keeping a human in the loop. Imagine an AI incorrectly flags a rural clinic as fraudulent because their billing patterns look unusual.
Right.
If that automated flag instantly shuts down funding, a patient who urgently needs life-saving cancer treatment at that clinic is suddenly denied care. You cannot allow an algorithm to accidentally turn off someone's life support. A trained human investigator must review the AI's flag and use professional judgment to ensure legitimate patients are protected.
But the problem is finding the humans to do that job, isn't it? The government needs an AI-ready workforce, but federal agencies are fighting a massive uphill battle to recruit people with serious STEM skills when private tech companies offer a vastly higher salary.
It creates a huge bottleneck. You have highly sophisticated criminal syndicates stealing billions, and a government struggling to staff the tech teams required to stop them.
And this massive financial strain, combining billions in criminal fraud with soaring legitimate medical costs, has now turned healthcare into a political explosive, which directly brings us to the current government shutdown.
Yeah, the fallout is completely dominating the 2026 Senate elections right now. The cost of insurance is hitting voters right in the wallet.
So let's break down the mechanics of these price spikes, because this is what you, the listener, are seeing on your kitchen table. During the pandemic, the federal government pumped extra subsidy money into the Affordable Care Act to keep people insured during a crisis.
Right, but those temporary funds are now expiring. Without that federal buffer, insurance companies are suddenly passing the raw inflated costs of healthcare, which includes those billions lost to fraud, directly back to the consumer.
And the resulting price shocks are severe. In Georgia, voters are looking at monthly premiums that could quadruple, pushing deductibles as high as $10,000.
And in Michigan, average rate hikes are projected to surpass 18%. Average families simply cannot absorb those increases.
So naturally, lawmakers are pointing fingers. And just to be clear, we are just looking at the arguments both sides are making here. If you look at the Democratic strategy, senators like John Ossoff in Georgia, who is up for re-election, are pinning the blame heavily on recent Medicaid cuts led by Republicans.
Right. They argue those cuts fractured the system. Democrats are staking the entire government funding battle on renewing those expiring Obamacare subsidies. They are flat out refusing to pass a budget to reopen the government unless those subsidies are extended to protect voters from the massive premium spikes.
But on the other side, the Republican strategy focuses on making the 2026 elections a direct referendum on the Affordable Care Act itself. They argue that if premiums are quadrupling, the system is fundamentally broken.
Yeah. Representative Jason Smith, who chairs the House Ways and Means Committee, claims that Democrat governors, specifically Gavin Newsom in California and Tim Walz in Minnesota, basically allowed these massive fraud schemes to operate freely under their watch.
Right, and Republicans point out that under the previous administration, President Trump's 2025 national healthcare fraud takedown saved taxpayers nearly $15 billion. They argue that Democratic states intentionally relaxed fraud prevention tools, practically inviting criminals to loot the system.
And to make the shutdown even more complicated, government funding does not happen in isolated single-issue bills. Everything is jammed together in massive omnibus packages.
Yeah, so this shutdown is also tied to fierce disagreements over funding for the Department of Homeland Security, specifically regarding ICE and Customs and Border Protection policies. So a bitter dispute over border enforcement crashes right into a healthcare funding crisis, freezing the entire federal apparatus.
It's a complete mess.
So what does this all mean for you? If you are a voter watching your insurance bill double next month, are you just caught in a partisan tug of war? Or is there a real chance this brutal shutdown actually forces Congress to fix the structural leaks in the system?
Well, it is a painful reality, but voters are largely collateral damage right now. The shutdown has very real, immediate consequences. Federal workers are furloughed, DHS contracts are suspended, and critical new federal health grants are completely paused. But from a political calculus, neither party has an incentive to back down.
Because they both believe they hold the winning hand for 2026.
Exactly. Democrats believe voters will ultimately punish Republicans for cutting Medicaid and threatening to let protective subsidies expire. Meanwhile, Republicans believe voters will punish Democrats when they see their premiums quadruple and read headlines about billions lost to fraud in Democrat-led states.
So the shutdown is the ultimate pressure point. Both sides are gambling that the public pain of the shutdown will force their opponents to surrender first, because yielding now could cost them control of the Senate.
It's a high-stakes game of chicken, and the American taxpayer is just sitting in the passenger seat.
We have covered incredible ground today. We followed the money from stolen medical identities fueling empty ghost clinics in California, bleeding $60 billion a year from a system designed to pay first and ask questions later.
Right, and we examined how investigators are trying to plug those leaks using AI to hunt for massive scale, hidden connections, and impossible outliers, all while trying to avoid the deadly consequences of bad data and false positives.
And then we track that financial hemorrhage all the way to Capitol Hill, where expiring subsidies, skyrocketing premiums, and fierce debates over who let the fraudsters in have paralyzed the federal government ahead of a monumental election.
It really highlights just how interconnected our systems are. A fake medical record in Los Angeles eventually impacts a premium payment in Georgia and a funding vote in Washington.
Absolutely.
Yeah.
But I want to leave you with one final, deeply unsettling thought to ponder on your own. We spent a lot of time discussing how the government is training artificial intelligence to catch these criminal syndicates. But technology is a two-way street. How long will it be until these highly organized billion-dollar fraud rings start utilizing generative AI themselves?
Honestly, the capabilities are already there.
Exactly. Imagine scammers using advanced AI to create perfectly realistic, completely undetectable fake patient histories. Not just clone names, but synthetic medical records, complete with artificially generated x-rays, decades of fabricated blood test results, and perfectly synthesized doctor's notes that easily pass a human audit.
It's a terrifying prospect.
If the criminals build an AI that is smarter than the government's detection AI, the $60 billion we are losing today might just be a drop in the bucket. The next time you are out on the pickleball court, just remember, the most sophisticated battle for survival might be happening right now, silently, inside the databases tracking your health.